And you don't remember the 100 animals that you saved. You remember that one that you made a mistake. And that's a lot of pressure. I think that was the spark of that feeling of there has to be a better way of learning. There has to be a safer way of learning. And yeah, was the origin of everything.
Welcome to Vet Life Reimagined, where we dive into the creative, inspiring, and often unexpected paths a veterinary career can take. I think today's episode is a must listen for anyone curious about the future of veterinary medicine and how 3D printing is shaking things up a bit in the best way possible. Our guest this week is Dr. Javier Sanz, and he brings an incredible energy you're going to love. He studied veterinary medicine in Madrid, Spain, and now calls the UK home. His journey didn't stop at traditional practice. He discovered a passion for surgery and a groundbreaking way to improve veterinary education with 3D printing models. We'll explore how 3D printing is revolutionizing surgical training, enhancing cadaver education in areas where cadavers fail to serve as an accurate training tool, and how turning a passion into a business takes vision, mentorship, and a great team. And yes, as my husband runs a 3D printing business, I might be a little extra excited about this one. So buckle up, you're about to hear an inspiring story about innovation, perseverance, and reimagining what a veterinary career can look like. Let's get to the conversation with Dr. Javier Sanz. When did you know that you wanted to get into veterinary medicine?
So that's a, a pretty good question, because I think there's a difference between when I found myself in veterinary school and when I really wanted to follow a passion in veterinary medicine. Because some people will be born with a clear idea, like straight arrow. I've been born straight from the first words, I want to become a neurosurgeon. I have a friend like that, like one vision through the life. And in my case, it was more like a pinball machine. So I will be bouncing all around, every now and then hitting the jackpot, and then the many other times hitting a wall. So I had a very good idea of what I didn't want to. So I was following that path of, I know that I don't like this, so I leaned towards science, biology, medicine. And then when the decision I had to pick between human medicine and vet medicine, that was an easy one. So I got into veterinary school, but it took me 3 years to find the passion and find something that I say, okay, that's what I want to do.
I think that's a really relatable story because I think even the people who had the initial, I've been wanting to be a veterinarian since I could talk, still doesn't always fully find that full passion after they've tried a few things and realized that's not maybe the exact direction.
Mm-hmm.
So I think that's important to share. And the other thing that, that you were sharing with me earlier was that, school was not necessarily the easiest thing to
Mm-hmm.
go through either for you. And so do you mind sharing a little bit about your college journey and kind of figuring out, oh, okay, I finally find some direction that I want to go. And then also into vet school up to that, finally finding your passion.
Mm-hmm. Yeah. And the summary of that is, it would be easier for me to tell you which subjects I didn't fail than the ones that I did. So I really enjoy college. I enjoy it so much that I stayed for a couple extra years just to get the most of it. But yeah, it was I understand that the first year in college is a way of doing some triage, like who's resilient enough to keep going, and I understand that. But it was kind of a shock, like getting into in university with very good grades, and suddenly first year and you are useless. It's like, okay, so this is gonna be the new norm. So for the first couple of years, it was a complete a cycle of, okay, this is the year. Well, it's not the year. I should have been doing something else. No, okay, let's keep going with this. This is gonna be the year. No, I have failed everything again. Okay, let's. And also, it was a little bit because of I guess, the way my brain works and the way I learn things, because I'm the son of two teachers, so they have taught me how to learn. But then I discover if I'm not interested in what I'm learning, then my brain will just shut off. And it was on third year when completely by accident, I discovered surgery. And I discovered that would be something that I can learn by doing. And my brain was like, that's what we would like. That's what we want to pursue. And again, it was completely random, but I got offered the internship. I was doing something completely different. I was in the middle of a protest in Madrid. There was a high tuition fees, so there was a strong student movement. So we decided to take the class to the street. So if you picture main street in a big city,
Yeah.
so we went there. Picture 100 students sitting on the street, learning how to do a neuro exam on a dog, with the dog of people, like dogs that were around, of people watching. And that's how we learned. And after that, I met my first mentor, and she looked at me, it's like, you have to join the surgical internship. I go, of course, yes, this is what I want. And then I discovered surgery, and I spent, that was the reason it took me extra couple of years, because I would spend all the time in theater with this surgeon.
And shout out to the mentors who can look past sometimes the rough aspects of results that we have and can kind of, okay, I see this. This might be the potential, and help us kind of get in that direction. So I'm glad that you found her and she kind of pointed you in the right direction,
Yes.
where you kind of had your aha moment of that. I like the hands-on, the surgery. I think you were also sharing with me too, there's something kind of wonderful about the fixing something pretty quickly.
That's it. And if someone had explained me how engineering works as a career, I might have gone towards that end, because I love to understand how things work and how to fix things. And sometimes I try to fix too many problems. And I'm learning that when someone approaches with a problem, I don't have to offer solutions. That's something that I'm learning. Especially with my partner, we are training on that. Like, I'm here to listen, not to offer any solutions, because you probably have thought about everything I'm saying already. But yeah, is that way of fixing things, or finding what's broken. And I guess every vet has that, at least a little bit of that, or I want to help. I can see suffering, so what can we do to help with that? And yeah, I think that I just found that path was the one I wanted to follow. And surgery was a very quick feedback loop, because you see something that is broken, or something that you have to fix, you fix it, and it's done. So that gave me a very quick positive feedback for that kind of learning.
And I think it was also towards the end of this schooling that you started to first get some taste of 3D printing. So do you mind sharing a little bit about how you were introduced to that?
Yes. So that was the last year at uni, and my flatmate, that is an archaeologist, hi Nestor, he was exploring how to create virtual models of historic artifacts. And that was cool. And I remember him scanning a statue in Madrid, and fighting with all the pictures and trying to do a virtual model. And that was cool. But then when he went ahead with the next step and thought about 3D printing that virtual object, that was cool. So we bought together a 3D printing kit, like a 3D printer kit, the worst 3D printer I have ever had, and the one that has taught me the most. And this is an advice: if you want to learn, if you just want to 3D print, then no. But if you want to learn 3D printing, get the cheapest, the worst 3D printer you can get, because you are going to learn so much. And I remember building this was 10, 12 years ago, and building that machine and hitting print and printing just a calibration cube, 45 minutes or 1 hour and a half. And we were just both looking at it, creating every layer. And then I was hooked. And he pursued that career of creating replicas, and he's doing amazing on that field. And that's when I thought there has to be an application for this in veterinary medicine. And then I started looking for papers, looking for scientific articles on this topic. And there were already a couple of them, first users using for education or surgical planning, some early information about surgical guides. And then I just did a deep dive on that. And I learned that step one for that is medical image. So DICOM files from a CT or a MRI. I had never dealt with a CT scan, but I just Googled which one is the closest CT scan in Madrid. And I found a place with a very nice CT scan, and I just introduced myself. Hi, I want to do this. I have no clue how to do this, but we are going to figure it out. And they were very nice. And that's another example of people wanting to lean in on that first user, first adoption, exploring new technologies. And I went from not dealing with or not having any experience with CT images to be able to have access to 10 years worth of studies. So then I had plenty of data to play with. And that's when we started creating anatomical models.
Now, didn't you have where you had to pause a little while and the 3D printing side? Because you went into veterinary practice there for a while, right?
Mm-hmm. So that will be between the end of college and beginning of professional life. Because as I like this so much, I approached my mentor. We are supposed to do a final degree dissertation. So I said, can we do it about 3D printing? And she was, okay, you do whatever you want. I'm not going to be able to help you with any of that, but it's fine. I will correct the papers for you. And we did that. And in the process of researching all that, we created a 3D printing lab at the university in the Complutense in Madrid. And that was fun because we were creating models for surgical planning. We were helping with the practical bits, different subjects, mainly anatomy and surgery. But the good thing about this is that everyone will come at you with ideas. And now that we have a company, we have decided we are not going to be thinking about the next product anymore because we have just a pipeline of ideas. And the tricky bit is choosing which one. So yeah, it was a wonderful experience. And when I finished the college, I wanted to stay there and develop this further because everyone was happy. So I thought, okay, they're very happy. Everyone is using this. So I asked for a grant or any way of them paying me for developing this. And they say, no, of course. So plan B. And the initial plan B was to still try to force my way into the university and stay with the 3D printed lab. So I thought, okay, if I apply for residence here, then at least I will be in the hospital. Salary will be like resident salary in the university, but at least I will be in the same building that the 3D printed lab. So traveling to the UK was just a strategy to make my CV more appealing, just to say, I have been abroad. I have been talking English in the consul. And that was the whole idea. I'm going to go there a couple of months, come back, do the residency and crack on with the 3D printing lab. That didn't happen. I came here. I love the hospital. I got offered a job. So I decided to pause the 3D printing for a bit and grow as a vet.
Best laid plans, obviously. But it sounds good. Like you said, you really appreciated the hospital. And there is some advantage of understanding even more on the challenges of the clinician. And so as you were becoming a vet, doing the practical medicine, what were you kind of learning? Because now you kind of have this unique position where you're thinking a little like an engineer from the 3D printing side, and you're thinking like medicine as well. And then you're having to take on all the other things that we have as clinicians, which can be really stressful. So what was kind of that period of time for you?
It was interesting because one of the reasons I accepted the job is because I was offered to join a new grad academy, new grad scheme. And I love that because coming from a university setting, for two reasons. One, is very interesting to have a very structured way of learning. So you can see, okay, for the next year, I'm going to be learning all these skills. So I, for sure, at the end of the year, I should be able to be proficient on these skills. But I guess that also is less scary when you know that there's someone ready to catch you if you fall. So if you're still a new graduate on a scheme that is teaching you, you always have a mentor. And if you make a mistake, you don't have, I will say, full responsibility because there's always someone behind you. So that was the idea. But then COVID happened. And the Neural Academy had to close for a bit, and it was online and less practical, and I didn't like that, so I decided to step out of that and just focus on first opinion practicing. And I guess that experience, like every new grad that goes to a practice, and I was very lucky of finding the place I found in the UK, and an amazing team, and it was the perfect bridge between first opinion and referral place. So we had enough people and enough knowledge and enough tools to do many of our cases. So if you are learning how to diagnose Cushing's, you can follow the whole case, not just have a guess and then refer for all the procedures. So here we can follow, and the same with surgery. And then when something is quite complex or we are very lost, we always have that referral option. But I guess that first experience on first opinion practice was a shock, because you go from school environment just based on learning, and suddenly you are working, and suddenly you are performing surgery in someone else's pet. And for example, one of the first challenges for a new grad in the UK, at least, is you should be proficient at doing a bit spay on your own, and you have to be no help. You have a nurse if you're lucky, but you should be able to go through the whole surgery on your own. It doesn't matter if it's a Yorkie or a Great Dane. You should be able to perform it on your own. And that's when I got the first feelings of, this is scary. Am I prepared? Should I be doing this on my own? And things like emergencies. I was also doing emergencies, and there will be you on your own on a hospital, or in my case, I had a nurse, and that was very, very helpful. And for the first 6 months, I think some of the nurses will know way more than the new grad, and that was very helpful having them around. But it's that feeling of the burden of a mistake that faces you. And I have made mistakes in my life as a vet, and thank God, not any huge major ones, but even stupid mistakes will chase you. And you don't remember the 100 animals that you saved. You remember that one that you made a mistake. And it's not only a mistake on that patient, is what happened with that patient, what happened with the family, what happened with yourself, with the environment at the hospital. And that's a lot of pressure. I think that was the spark of that feeling of, there has to be a better way of learning. There has to be a safer way of learning. And yeah, that was the origin of everything. I can remember me performing this space, and even after more than 200 surgeries, I will still tense when I have to pull from the ligaments and turn the ligament. Like, I will clench my butt and just breathe, and that's it. And from 250, maybe 4 of them bled, but you always remember that one. You always remember the one that bled. And so, yeah, I was thinking that there should be a better way, because at the end of the day, in this surgery, for example, it's all about how confident you are with your suture. Everything will boil down to, are you happy closing with that knot there? Are you happy with that suture in place? And that's something that you can practice outside the animal so many times, that you can do this blind, and you can just have a feel, and you can be confident that that knot is secure. So then you cut, and you are going home, and the dog is like going home, and you don't be awake in the middle of the night like, was that tight enough? So yeah, I think that was the spark of, I don't want to feel like this every time I perform a surgery. I want to approach a surgery being 100% sure I have done this so many times, I can do it with my eyes closed.
Yes, I think everybody has had that feeling before. And it made me feel much better one time when I heard a board certified surgeon say, a spay is not an easy surgery. It's It is not an easy surgery. So, to be a brand new grad and, like you said, expected to be able to do that entirely
Mm-hmm.
yourself. I don't know about you, but I know that most of the schools currently or in the past in the States,
Mm-hmm.
we are lucky if we have done one or two spays
Mm-hmm.
before we graduate. So, I'll speak for myself. Definitely not confident to do an entire spay by myself
Mm-hmm.
after vet school.
That's the thing. And I was very lucky that I could be at the internship, at the surgical internship. So there was a point
Right.
where I was teaching other students how to do a spay. So I have
Okay.
been able to do, maybe through university, I was able to do 20, 30 cat space and dog space, teaching other people. And also that's an amazing way of learning. If you have to teach something to someone else, then it forces you to, well, in theory, it should force you to really understand all the nuance of the procedure to be able to explain on a clear way. But I agree with you, it's not an easy surgery. And not so much for the surgery itself, that can be very, very tricky sometimes when you get that obese, deep chested, or just a greyhound or that kind of thing. That will be like, you look at it and it's like, you're going to bleed. I know you're going to bleed. Just looking at your face, you're gonna bleed. But it's also that the owner doesn't think it's a complex surgery, because
Mm,
it's the surgery that every female dog or 90% of the dogs will have. And it's the surgery that usually is so cheap because that's what they will be shopping for. So hospitals will make it very cheap to attract clients. So most of the hospitals will be losing money on that surgery. And it's more like for them, it's a routine thing. Like, I drop my dog in the morning, I'm expecting to collect the dog in the afternoon. And because my dog is a young, healthy dog, I'm expecting no problems at all, because it's very easy to grow confidence if it's 3 in the morning, you get a plenic mass bleeding, and the options are either you do something or it dies. So then it's like, okay, we do something, because the alternative is it's going to die now. So if we can, and also the owner knows how severe the problem is, and the owner is already expecting there's a big chance that this is gonna go downhill very quick. But on a beach spay, they're like just a check in, check out. I'm expecting no complications, and that's extra pressure on the person doing the surgery.
that's a very good perspective, and just thinking about that, that's a lot of pressure on a general practitioner. And maybe another example that I think comes up too are dentals.
Yes.
I think that owner is expecting, "Oh, I go get my teeth cleaned,
Hmm.
easy peasy, hunky dory." But that's not always the case because there's anesthesia involved. A lot of these dentals are, we brush our teeth.
Hmm.
We get dentals twice a year. We're lucky if we can convince them to do it once a year,
Hmm.
right? And with no brushing in between. So, it's a lot more complicated than probably the pet parent thinks about.
Hmm.
And I wanted to add that because I know dental is a big deal for you.
Yes.
So we'll get to that. But yeah, no, it's a great point. This opportunity to provide more opportunities for education. And so it sounds like with that inspiration, and then somehow you got this opportunity to maybe go back and explore what you had originally wanted to do with 3D printing.
Hmm.
So what was that story of starting to maybe get that opportunity?
Hmm. So I I got a call that was almost 3 years ago, from a professor at the university in Madrid, that he knew I wanted to develop this 3D printing lab, and he was helping, but then we couldn't do anything, so I have to leave. So he told me there's a new university opening up in Madrid, and they want to develop this, and they want you to run it. I was like, okay, that sounds good. But also, I have my life in the UK already. So I have my partner here. I have my job. I was really enjoying life here. So I tried to make it work, working from the UK, but helping establish the 3D printing lab. And well, it didn't happen for other reasons, but also I think we have this concept of trying too hard. Like if you are forcing it too much, maybe that's because it's not the thing that should happen. So that opportunity didn't happen, but that spark, it was a fire already, because I already pictured myself doing it. And that's annoying, because I was very happy. I forgot completely about the 3D printer. I had a 3D printer here inside a box, never used it for 2 years. I was studying ECC certificate and emergencies. So I was walking my new path. Like, okay, I'm gonna specialize in emergency and critical care, and then I might become a specialist, and I'm gonna follow this surgical path, and I don't have to worry about anything else. And then they dangle this idea in front of my face. I was like, okay, that's gonna be amazing, and then they remove it from the table. So I was already thinking how to do this. Of course, as a vet, I had zero business knowledge, zero. So I had my knowledge of, if I want to make a business out of this, okay, I guess like I get some money and I invest in a couple of printers and I do some models and I sell those models and get some money. And maybe in 30 years, I have enough money to hire someone. But then I was lucky that I was able to sit down in front of a business mentor now for me. And I asked for like an hour of his time, and he said, of course, like just come to me with a business plan and your idea, and we will discuss this next week. Like, perfect. Yes, let's do that. As soon as I hang up the phone, go to Google, how to make a business plan, because I had no clue. So I pitched the idea with the worst business plan ever written. And he liked the idea, and he knew that the business plan was shit, but like he liked the idea, and I guess like he liked me, because at this stage, when someone invests time or money in this stage of just an idea, it's more about who had the idea, who's going to execute the idea, than the idea itself. And yeah, so I started doing a proper business plan this time for another year and a little bit more. And then I think that he saw that I didn't give up. So he helped me with that first seed round of investment, so we can kickstart this. And then I have been learning business since. I know that this much right now, but that's enough to be able to have a business plan that I don't follow.
All true things. And the other thing, I thought it was neat, because I'm a nerd and I listen to entrepreneur podcasts and things like that.
Mm-hmm.
And you mentioned about finding a niche or a niche, depending on how you want to pronounce it, when you are coming up with a business plan, especially when you are a small business. You're starting, you have to start somewhere. And I thought that was really unique, because I think you said earlier, you get lots of ideas, right?
Mm-hmm.
And so you have this whole list of potential things, but to really get started, you have to really figure out, what is that one idea that I lean into to make it really successful? And then maybe down the road, we can explore ideas. So as you're understanding that, what are you thinking? Like, what are your thought processes to get to that one idea to really lean into? And I guess I'll preface a little bit for people that are not as aware of 3D printing. You mentioned some examples before, right? There is printing models for surgical prep. There's educational content. There are guides to help you in surgery. So there's lots of things that you can use 3D printing for. What was the path to knowing where you wanted to start with this business?
So I would love to say it was very clear from the start, because I had this idea. The clue is that we had absolutely no idea which one was the way, and we are still figuring it out. We are still trying to niche down until we find it. I feel like we are very close now, but it was all about focus, and I had to learn this from the business mentor as well, because when I started, I was able to have some help from another friend, that is Jose, that is my co-founder, and he had experience in the business world as an economist. So he took my hand and walked me through business 101. It's like to set up this foundation. But then it's what you say, like, okay, I understand I want to do something regarding 3D printing, veterinary medicine, and I know the frustration I want to help with, but I had no idea because, as you said, narrowing everything down, there are three big buckets of things that you can do with combining medical data and 3D printing. One will be educational models, meaning show and tell, more than to perform surgery to explain a specific procedure. The second one will be patient-specific models, meaning instead of I'm going to teach this procedure to 50 students using the same model for every one of them, will be more, I'm a surgeon and I have a specific complex case of this dog that has been hit by a car and has a very complex fracture. Can you create a model for me to practice the surgery? So you can provide them with a exact copy of the anatomy so they can test, measure, pre-contour plates, try different approaches over and over. When they're happy, then apply those concepts to the surgery. And the third one will be surgical guides, 3D printed implants and titanium implants and all that complexity that is following the path of human medicine. So again, I was very clear, I was very sure about what I didn't want to do. That was that third one. I'm not a specialist. In order to design those guides, you really need to understand the procedure, the complexity of the surgery. And then if you get into 3D printed implants with the titanium print, that's a path I don't want to walk. So at the beginning, we said, okay, we can offer educational models and we can also offer patient specific. So if we are in the UK, we can nail this so we can do a turnaround of 24 hours since you send the CT images until we ship the model. But then we noticed that it was too big of a challenge for someone so small. And we decided to focus and go all in on education. And it was just a math question of if our goal is to help as many vets as possible, but also as many animals as possible, education is exponential. So if we help one vet learning one technique, that vet is gonna help thousands of animals. So on our stage, we feel that's the best way to go. So that's why when it's annoying and it's frustrating because we get people approach, we are approached to create patient-specific models, and we have to say no, but we are very happy to explain how you can do this yourself, because we also believe this is the future of surgery, that having an in-house 3D printing lab, I'm calling it 3D printing lab, you just need one printer and someone willing to learn. And right now, it's so easy to learn how to use even a basic filament printer with a tiny investment. And even if I'm not thinking create your own surgical guides in-house. That's way more complex. But what about having a mandibular fracture? So you just learn how to have a virtual model of your mandible, mirror it, print it. It's gonna take maybe 10 hours on a normal printer and cost cents, but you can pre-contour the plate and you can save maybe 40 minutes of anesthesia. And that's 40 minutes of the patient not getting colder, not getting hypotension. So there's so many things that you can do with a little investment. So we are trying to create awareness on how easy it is, or well, how simple it is. Then the moment you get into more complex 3D printing is a little bit more messy, but the foundation is very easy.
I love that. And that is exciting. I know that in human medicine, there's more and more 3D printing. I already know, and I think the surgeons really have been leaning in because of that very use for it, is to have an exact replica of this, the challenge in front of you, and to have the opportunity to go through an entire procedure to feel confident going in. Not only are you saving anesthesia time, but hopefully the outcome outcome could be more successful because you've been able to try a couple things and figure out which one works without having to do it in the middle of surgery. So it's quick, you're in there, you found the best way that you think, and you send the patient on their way. I know that's a little more simple than it
No, but
is.
the idea is
There's
there.
little
Yeah.
and so even finding the direction of looking more at the educational models, even then you can start getting more specific
Yes.
into what area is the biggest need. And I mentioned the dental part of it because I have seen some of the videos you have shared on LinkedIn, and it's so cool to watch how visible these things are for a learning situation. So how did you decide to kind of get even more specific on the dental models?
Yes. So again, this is becoming to be a thing here, completely by chance. Because when I started, I hate dentistry, and the reason is because it's like anesthesia. If you have no clue of anesthesia, you hate it because it's scary. You have no idea what's going on. You don't want to make a mistake. You don't understand all the beeping things on the machine, and then you understand the basics. It's like, okay, I'm starting to enjoy this. How can I improve the anesthesia? So I feel that with dentistry is the same. Like the gap between 0 to 1, from having no clue to having some clue, is key. So again, I was trying to find a source of medical image now in the UK. So I did what I did back in Spain. I Googled what's the closest city to me, and I found the hospital. I looked through the team. I found that the dental specialist was Spanish. Like, okay, let's pull this thread. I contacted her, super lovely. So I was invited for a visit. Like, perfect. So it looks like we might be doing something dentistry related. And when I arrived, there was another vet visiting. This time it was a specialist that will come there every couple of months, and his name is Jerzy Gabor. That is the now elected president of the WSBA. So someone that has been doing this for a while. And when I was about to introduce myself, he told me, "You don't have to pitch anything to me. I know what you're doing is the future." So it's like, okay, we are doing dentistry now. So because having that opportunity of being able to pick the brain of someone that has been doing this for 30 years and that in many times he's the pioneer of many techniques, I had to use that information and use that brain. And every time, like, he's a very busy man, but every time I have some time with him, I will just squeeze every piece of information out of him. And it's amazing. And that's when we started. And thanks to that feedback, we were able to create a quite complex model of malocclusion in dogs and cats. And that was the first big order for the European School of Veterinary Advanced Studies. And that's when it became real, because then I had to produce 60 models on my own in the spare room with the resin printer on awful setup that I don't want anyone to replicate because it wasn't health and safety wise. Don't follow that. But then when I finally finished the last one, quality control, awful amount of failures, and just managed to ship that, and you see people using the models and really understanding the technique, yeah, that made it real. And then from that moment, I knew I had to find some other advisors. I had to build a team. And that was the next step of how do I assemble my Avengers of veterinary education and 3D printing and 3D modeling and surgical expertise to make this a reality. And that would be that was the next step.
Well, I want to highlight something you said. You talked about that when you don't understand something, that's when it's scary. And back to the better we can practice things and learn things, the less scary it is, and it opens up for not only for it not to be scary, but for us to even enjoy it. And it just made me think. I kept going down that route, and it's like, if you thought about that opportunity in vet school to try out so many different things where you were able to at least do it enough where it's a little less scary and you're starting to find the fun. think about that opportunity of, well, maybe I could have found the specialty I was really interested in or that my niche that I was leaning into a little bit earlier if I
Hmm.
had that opportunity to try out more things.
Hmm.
And it's hard because there's so many things you can do in veterinary medicine. We only have four-ish in the States years to go through all the things we have to learn
Hmm.
before they'll let us out with a DVM degree. And so just that opportunity to, because you've been able to remove a lot of the barriers, because I mean, thinking about like cadavers, and there's a lot of challenges with cadavers, which we haven't mentioned. So maybe we can talk about that.
Hmm.
Is not only the logistics of getting the cadavers, but now there's a lot of ethical concerns
Hmm.
about those cadavers. I think you've worked on some papers and you've looked at some things around that challenge, the going from cadaver models to a more sustainable
Hmm.
3D printed model approach.
Yeah. So that's the question. That's the main issue. So before we get into the cadaver, because we can talk plenty about that, what you mentioned of it will be the ideal world will be that where the veterinary school is providing you with all those opportunities every year so you can try a little bit of everything so you can find your passion. And it will be amazing if that happens, but also it's very tricky. But there's a shortcut for that. That is, you don't need the vet school to organize that for you. You can do it yourself. But that will be do things outside the classroom because you never know what you're going to like. You never know who are you going to meet. And the more people you meet, the more experiences you have. You don't know, like I'm in the UK because I met someone at a conference 7 years ago and then they invited me here. And they call it in Silicon Valley, they call it expand your lag surface, meaning that the more things you do, the more people you meet, the more things you learn, is that you have more chances of being lucky, of having that conversation that changes everything. So yeah, I will use that as a shortcut until vet school is nice and well structured in that way. But yes, and then with cadavers, that's the main issue. And it's a tricky one because we really understand the importance of cadaver-based training. And that's something the same way we say using one of our models doesn't mean that you go from the model to the patient in one go and you can skip proper training, proper guidance, doing this with a mentor. No, that's not the kind of philosophy that we want to transmit. So it's true that cadaver-based training is key for many procedures. We are just trying to reduce the amount of cadavers that are used when they are not needed. And I'm thinking about two scenarios. So one will be when you are teaching something that is not present on the cadaver, because then what's the point? So for example, if we talk about the malocclusions that we mentioned earlier, the whole procedure is around what's wrong with this specific patient. What's wrong with the way the mouth is closing. So in order to learn that, you need to be opening and closing and opening and closing and measuring and hitting the crown and checking that you are doing a good job or it was too long. No, there are so many little details that if the way you learn is look at this dog with normal occlusion, imagine there's something wrong and now fix it. So yes, you're going to understand how to maybe use the dental composite or how to plan a crown, but you are not doing the procedure of opening, closing, measuring, opening, closing over and over and over again through the surgery. And the other example is BOAS training with brachycephalic syndrome, that right now, at least in the UK, the main way of teaching that is using foxes. So you are teaching a problem that is common on brachycephalic breeds, meaning everything is shortened and the face is flat, and you are using a different species that don't have any of the 3 to 5 things that are common on brachycephalic breeds. So when is that balance between realism on the cadaver and realism on the model? Because also frozen and thawed and frozen again and this froze cadaver doesn't behave like real tissue. So, for example, with a silicone nose, what is more helpful from an educational point of view? Having the real anatomy of the patient that you are learning about, in this case, a very close stenotic nose on a bulldog, or having something that is real tissue that has been defrosted. So we are just trying to help, because also if you think about the logistics behind running a course with cadavers in comparison with just choose a room and we will send the models and you don't even have to clean, because what the delegates will like to take the models home. So you don't have to do cleaning. Like, good luck when you are dealing with cadavers, all the prep. I have been helping in courses, in surgical courses as a student. I know all the prep that you have to do before, during, and after, and transport, and the freezer, and all the surgery. So it's a lot. So if you can standardize training, provide every student with the same case, so the teacher knows what to expect, no, like a lottery, like, well, we'll see what we have today. So that's very valuable. So we are not so naive that we are saying, let's get rid of all cadavers. It's just, do we need a cadaver to teach this? Or can we use something that is as good? Or in many occasions, can we use something that is way better than a cadaver? So that's the approach that we are trying to, you can say, I'm a bit passionate about this, you can tell.
No, and that's good. That's a good sign. That means you are in a good place because you're getting excited about it. And I couldn't help but to think about this question while you're talking.
Mhm.
Are your parents very excited that you have leaned into the education? Like, you're following their footsteps, maybe just a little?
That's an interesting question, because you're asking a micro question, and probably they're happy. The question is the macro question. Are they happy that I decided to get rid of a nice job in a secure hospital with my life plan, with my nice salary, with my mortgage and everything, and say, you know what? I'm going to stop doing all this and I'm going to do something that I have never done before, that is going to cost a lot of effort and money. And I don't know, like 99% of people that try this fail. So when I pitched that, it wasn't that successful, and I understand, because they are teachers, and in Spain, when you're a teacher, you work for the government, meaning that since you become a teacher, you know for sure that you're going to have a job until you retire. So that not knowing where your next job or your next client is come from doesn't exist. And I understand that. But yeah, that was an interesting conversation. But I'm very lucky of two things. So the first one is my partner, because my partner believes in me more than I do, and believes in this idea more than I do, and is behind everything that we make here, and every low moment is there to pick me up, and I wouldn't be here without her. And then the team that we have assembled, everyone, when I'm consuming a lot of business content to learn, and everyone says that hiring is the most difficult thing, and I'm concerned about hiring someone else, because so far I have like 100% of success with the hires, that I wouldn't be here without them. Not only with advisors that we have, my business advisor, and then we met Jersey, and then Alexis Santana, that is a cardiologist in Spain, in Canarias, that has also been amazing supporting us. But when I met my only employee right now, I couldn't believe it. And I wasn't looking for someone, and suddenly I got a call from a friend that, again, I met 8 years ago in a conference, because I was a volunteer there, and she never calls, she always texts, and she called me, so I knew it was important. She knew what I was doing, she knew what I was building, and she told me, you need to call this person right now. because she has just been made redundant and you want her on your team. I was like, okay, I trust this person. I call her, I meet Rachel, and I offered a job on the spot because she is amazing. She's the reason we are where we are right now. She's the hands behind of the models. Like now we have a team. We have a very good 3D artist that is Alberto. And the three of us, it just works so well. Our brain works on a very similar way, especially Rachel and I. That will be like ping, 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 all ideas, and we are learning to focus. But the ability of being able to discuss an idea, having Alberto to create the 3D model, having Rachel to iterate on that and create the physical model, and create that a cycle of feedback to create and dispatch a product from scratch within days. We had a project few weeks ago, and I did nothing. I introduced the challenge because we were asked for very specific model, and I just stepped back and I saw them work, and they produced something in less than a day, and we went with that. They produced the final product in less than a day, and so yeah, I'm so happy that I have them, and so lucky that we have this team together. Yes.
What an amazing way to start to close this conversation with you. I am so excited to hear that. A lot of people know that I'm very enthusiastic about 3D printing and what we can do with it. I see a lot of opportunities for educational use, not just in a university setting, but even within a university setting, maybe the surgical club or, the dental club, or, they might be able to access these resources for themselves, but even pharmaceutical companies or companies that need to be able to teach a product or something, they would have need for a bunch of models to be able to teach things. So I see a lot of potential use cases. I hope it continues to grow for you and everything is just aligning. So just to kind of make sure, if somebody is interested in learning more, where can we point them to learn a little bit more about what you're doing?
So the easiest way to do it will be through our website, GaiaBiomodels.com, or our LinkedIn. Again, we are very easy to find. So Gaia Biomodels is the name of the company. And even if now we are a very young company, we are releasing models, we are releasing the catalog, and there's so many things that we have on the pipeline. So even if you see what we are doing and you don't see anything that is for you, still follow us and get in touch, because if you have an idea, probably we can help. And the need is too big and the opportunity is huge. So we can't make it all ourselves. All the specialists, they need these models, and we are not going to be able to do this for everyone right now. So if you are into orthopedics or neurosurgery and you want to develop something, but you are in a university, you are a student and you want to do it yourself, get in touch. We will tell you how to do it. We will tell you the basic. Or if you are a specialist in a hospital and you are wondering, patient specific models, how can I do that? Just get in touch. Get in touch, because if you are willing to put, I want to say 10 hours of your time into this, you can be developing a 3D printing lab for very basic, but most of the time you don't need any fancy things. So that's the summary. Like, there's so many things that can be done. Right now, we can't make them all. At some point, I would love having a catalog of every single specialty with 100 models each. So if you think this is calling you, if you agree that this is the way to go, just get in touch.
Well, thank you so much.
Thank
I'm
you.
so excited for this. And again, like I said, continue to follow you. You do great on posting lots of pictures and things on LinkedIn. So it's been great to watch you. And yeah, I'm excited to see what is next for this and the future of veterinary medicine. So thank you so much for what you do.
Thank you. We're just starting. Thank you so much, Megan.